if you look at the data, if you look at research, what research shows is that a lot of the stuff that you see advertised on TV and that they sell in department stores really doesn't do a whole lot. What has been clinically proven to work in scientific studies, in the year 2013, tretinoin, which is generic Retin-A, is still the king. And tretinoin has a lot of effects on your skin, including potentially minimizing the development of precancers. Tretinoin is something that I recommend as part of a skincare regimen for just about everybody. About 3 or 4% of patients can't tolerate it. It makes their skin too red and peely. But there are ways around that. And tretinoin is something that we recommend be applied at bedtime. Peptides and growth factors are present in a lot of products. And the interesting thing is that basically what a peptide is a piece of a protein. And just because somebody takes some protein and puts it in a blender and then puts it in a cream and then tries to sell it to you, it doesn't mean that this is something that's going to be effective. And a lot of the products that are out there are basically exactly that. The peptides that seem to really work are growth factors. And you know, for my money in the year 2013, and you know, tretinoin is a generic name, and I don't really like to talk about branded products and endorse one branded product on the other, over the other. But with regard to peptides, you know, the product that has the most data associated with it is the TNS products. And so, you know, if you were coming to me in my office, what I would tell you to do would be to get this product. It's called Tns Essential Serum, and it contains growth factors, and I would tell you to use that in the morning or during the day, and I would tell you to use tretinoin at night. Alpha hydroxy acids, that's basically glycolic acid. The way that glycolic acid works is that there's a protein in your skin called hyaluronic acid. Hyaluronic acid is the sponge in the skin. It absorbs water, and it's what keeps your skin moist. And alpha hydroxy acids expand the amount of hyaluronic acid in your skin, so it keeps your skin looking nice and moist and dewy and not all dried out. And then there are some free radical minimizers that are helpful adjunctively. I think that by themselves they don't do a whole lot, but there are products that contain vitamin C and copper and other products which minimize free radicals and are responsible for helping the skin make proteins that it needs to keep you looking young and healthy. And there's a lot of different products that can contain these free radical minimizers. All right. So now let's talk about procedures. Yes?
A quick question. On the TNS, do you need to have is that a prescription? Or
No.
Can we get that from there?
Yeah, no, you don't need a prescription for TNS.
I wanted to ask you, the alpha hydroxides, when they go out of date, do they just need to be thrown away, or are they good like a lot of medicines that'll last?
Yeah, you know that I don't recommend using there are some things like tretinoin. Tretinoin is a highly unstable molecule. I tell people when their tretinoin expires to throw it out. Mm-hmm. You know, those alpha hydroxy acid products, they're probably okay for a couple of months after they expire, but definitely not